Okay, good morning, everyone. I'd like to call a meeting to order. The next meeting of the Board of Health will be held on Friday, April 15th, 2022 at 8 a.m. in the Selectmen's Meeting Room at the Richard D. Carney Municipal Building, located at 100 Maple Avenue, Shrewsbury, Massachusetts, 01545, at which time and place the Board of Health will consider the following agenda. The first item on the agenda is the review and approval of minutes from the March 4th, 2022 Board of Health meeting. Do I have a motion to approve?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting minutes are approved. The next item on the agenda is review and discuss the 2021 to 2026 Greater Worcester Community Health Improvement Plan, otherwise known as the CHIP. And I welcome the representatives from the Central Mass Regional Public Health Alliance.
Cool. Thank you so much. Maybe I can introduce everybody. So my name's Casey Burns. I'm actually the director of the Coalition for Healthy Greater Worcester, and I'll talk about what our role is here. But we are a community-based coalition that works as kind of the primary implementation agency for the Community Health Improvement Plan. But I am here with my colleagues from the Central Mass Regional Public Health Alliance, and want to just give them a chance to introduce themselves.
Good morning. I'm Karina Scott, and I'm new to the Alliance. Before this, I was working for specifically the Division of Public Health in Worcester, motivating the Latinx population to get vaccinated with flu and COVID-19.
Thank you.
Good morning, everyone. No, you're good. Good morning, everyone. I'm Brendan Keenan. I'm the Chief of Community Health for the Worcester Regional Department of Public Health. Nice to see you all.
Thank you.
Matt, do you want to introduce?
Morning, my name is Matthew Moore. I'm the Communication Specialist for the Worcester Division of Health and as well as the Alliance. Nice to meet you.
Great, thank you. Welcome.
So we're happy to kind of share just some framework of what we've been doing in public health strategic planning, and really hope to show how close of a partnership this is with the community and municipality on coordinating this work. So the Community Health Improvement Plan, or the CHIP, is the regional strategic plan for addressing health disparities, improving community health. And the Coalition for Healthy Greater Worcester is this convening agency. So in previous CHIPs that had been coordinated, it was more of an interdepartmental plan, and the community really saw it as that. Even though it was named as this larger community-wide plan, they really saw it as this is DPH's strategic plan. And so in 2015, some core partners who worked together to do the community health assessments, UMass Memorial, Fallon Health, and Division of Public Health, decided to pull together and coordinate and think about what an alternative structure would look like. And so invested in this community coalition that had existed under the name Common Pathways, or it's also known as a CHNA 8, Community Health Network Area 8, to think about the coalition more firmly like hosting and serving as that implementation agency to pull people together so community could see themselves more in it. Division of Public Health could be then more connected with the CHIP and the community work. And so the coalition serves as the implementation agency, but then works closely in partnership with Worcester Division of Public Health and Central Mass Regional Public Health Alliance are like kind of the lead partners handling federal accreditation. And then UMass Memorial Healthcare and Fallon Health are leads on the community health assessments. And I'll just review again, I'm sure many of you are familiar of how those to work together closely. And so what the CHIP generally looks to do is seek to align resources and funding and attention to the identified strategies that the community identifies through this process in order to move them forward over a set period of time and hold kind of systems for accountability. And so the CHIP follows the same region as the Central Mass Regional Public Health Alliance, which is now Worcester and Shrewsbury, Millbury, West Boylston, and Grafton. I would have gotten there. No, thank you. And so it's really meant to serve as that strategic plan for the whole region. You can go on the next slide. And so just so we clarify, because often the terms are used interchangeably, so we inserted this slide. The CHIP is the document, that's the strategic plan, and the coalition is the convening agency, and we're really supposed to serve as that scaffolding. And I'll talk a little bit about that work. It's not our plan. Our role is really to be kind of that bird's eye view. Is someone doing this work that the community identified as important? And if they are doing it, how can we increase and support impact? How can we bring in resources, a new funding relationship or a partnership relationship, introduce data, engage community, whatever we can do to help to support that. Or if it's not happening, how can we help to kickstart it? And the only place the coalition serves as kind of direct service in that work is when it's an item of capacity building or as kind of a temporary incubator to help support it. So we're not accomplishing these strategies, but just, helping to support partners to do that. And just sometimes we hear, I hear folks say, that's not a CHIP strategy, that's my strategy. I'm like, they're all CHIP strategies. And so we've tried to think about how do we improve the language to try to think of it. But it's really a unique role in that, that to be kind of a strategic plan for everyone it is an interesting role to play, but I think it really brings a lot of value to the space and, really a non-competitive, wide view of what's happening. So the CHIPs follow the CHAs. So the CHIPs, the CHAs, and the CHNAs. And so the CHAs are the community health assessment, which are required by federally accredited health departments, nonprofit hospitals, and public health insurance agencies like Fallon. They're required every 3 years to collect data, understand what are the priority health concerns and what are the priority populations for the region. So the 2015 CHA was the basis for data that informed the 2016 CHIP. The CHIP is really so what are you going to do about it? And so there's also a community engaged process that we do in order to develop those strategies, which I'll talk about, but it's really supposed to be based on those data. We understand that, there's always going to be places where data needs to evolve, be updated, disaggregated further. So there is a consistent data collection process, but really we base it on that foundational data pool collected in the CHA. The 2018 CHA informed the 2021 CHIP, and now there's a new 2021 CHA, which we are using again as more of an iterative, ongoing relationship, and hope to move in that direction where it's not as much as a start and stop, but we're consistently updating data, building dashboards, understanding how that's collected, so we can be constantly improving our strategies. The 2021 CHIP really focused in developing its process to be more upstream, and I'll talk quickly about that in a second, equity-centered, community-driven, and more focused. For those of you who remember, the 2016 CHIP had 100 strategies over 9 priority areas. It was a lot, but I still liked it. I felt like it was representative. It's a big region. There should be 100 things we're doing over that, but it was a lot to handle and manage and didn't provide the focus for funders and decision makers to really know how to prioritize. The 2021 CHIP has about 22-ish strategies, and I'll show you that in a sec. So by upstream, just quickly, we're frozen.
Are we frozen?
I
Yeah, we're froze.
Oh.
Oh, okay. And then it went really fast. All right.
I could talk through it even if it's not. The
You can talk. I'll
okay.
talk.
The 20 so the when we say upstream, just to clarify what we mean, we use this framework, which is the Bay Area Regional Health Equities Initiative, which, we help to clarify what we mean by that. What do we mean by working on kind of structural conditions rather than individual? And this was a helpful way for me to understand it and be able to articulate it better. So we know, actually starting at downstream, we know rates of mortality are impacted by disease and injury. Lung cancer changes rates of death in populations. We know risk behaviors like smoking impact rates of lung cancer, which impact mortalities. But whoever's kind of less understood by the public, I think, is how those structural conditions, and we've started to use those language, just as closely related, impact risk behavior. So living conditions such as, or known as social determinants of health, housing conditions, our healthcare system, educational systems, public safety, employment, all of these things drive and determine risk behaviors. And this is when we start moving more into the structural. Institutional policies and inequities within those policies drive how living conditions are built. So governmental systems, funding policies, whatever that may be, those determine, how well our housing stock is developed. How affordable it is and equitable it is to access. And then we know that those institutions are made of people, and so our societal values determine those institutional policies. And so this is where we really understand and look to articulate the framework of racism and sexism and ageism and ableism and all of those things that really drive institutional inequities. And so when doing the CHIP and doing the CHIP development process, we really look to frame it under those structural things instead of individual behaviors, because we know, even though we may impact, individuals' healthy eating habits or walking habits or, not smoking as much or whatever it may be, that we're going to still find similar trends in populations if we don't look upstream to what are the driving factors. And so in developing the 2021 CHIP, we like to show this diagram that, wasn't just pulled out of nowhere. This is really the development process. As I said before, it was built on the 2018 CHA. But so that the CHA data primarily shows, although there is social determinants of health data there, but it primarily shows health outcome data, rates of diabetes and hypertension and certain cancers or senior falls or whatever that may be. And so in order to move upstream in our framing, we pulled together first, before diving into the strategy development, a pool of about 40 to 50 stakeholders who were experts into priority populations with lived experience, but also who had subject matter expertise in the areas to pull together and perform a gap or root cause analysis. So what are the conditions that determine or impact those health outcomes where we're seeing disparate incomes? And so then they kind of did this fishbone analysis, overlaid them, and came up with what are the common themes that we could be organizing around in order to really most impactfully develop strategies. So once we had that, the coalition was able, through a grant through Health Resources in Action, we're able to hire 10 community members who were across the region, lived across the region, had experienced those populations, to then determine how do we best organize community conversations. And then in November and December of 2020, over the holidays during a pandemic, we organized about 35 community conversations with 100 people where we looked at the data, we looked at the themes that emerged and asked people, so what would be the most impactful ways to do something about this? What would be the things that would improve your health in the long term? And so that, we then analyzed that qualitative data and held prioritization open meetings in January of 2021, where we then invited institutions and partners to help us to further refine those, and then a larger community forum to give feedback on a first draft of the CHIP. And then we came up with the CHIP. So this is the result of that work, is the 2021 to 2026 CHIP. And so I'll go through each of these sections really quickly, but just to orient you, the CHIP has 3 major sections: municipal racial equity policies, and this is really recommendations for how municipalities run, what their mode of operation is that can help to drive more equitable outcomes. The second is community-wide change campaigns, and these are community policies and priorities that are led by different community coalitions that we're saying are the most important, impactful ways that we can kind of address those social determinant obstacles. And then the last one is we called a prioritized strategy and action agenda. I don't know why we called it that. I feel like the names are confusing, but this is really a list of 6 principles that we are recommending through this process that programs and organizations, institutions use as a reflective lens to think how they can improve their services. And I'll just go through them each pretty quickly. So in municipal racial equity policies, the 3 principles that we are looking to uphold is adopting community-led racial equity trainings for all staff, boards, and commissions, working with and compensating grassroots leaders in oversight and decision-making, and using community-vetted equity tools in department, board, and commission planning and decision-making. And so some of these things, I think, we understand this is a 5-ish year plan, and it's going to take some time to get here. And we're not asking to pass policies right away because we don't want to, sometimes it can cause harm to move too quickly. And so what we're doing is to seek to understand what these mean, what the implications are, what their relevance is within kind of an audit scan of what the operations are already. And then also to come as the coalition, we're looking to come with resources and kind of toolkits of best practices and ways that these can happen and evidence to show that they can be impactful. So our racism and discrimination subcommittee is kind of collecting information on where there are available trainings currently. There's also was identified a gap of open community-wide racial equity trainings that if people said, yes, I do want to opt into those, but they can't do it, or do I have to hire the People's Institute out of Georgia for $15,000 to come here and do it? And so we've actually been working on developing a training institute that holds free open community trainings that folks can participate in, and I have the flyer for one with an open registration at the end, and so I'll circle back to that. Working with and compensating grassroots leaders in oversight and decision making is another model, and we're piloting and using that with our community cohort that's leading community conversations. We're also working currently with the city of Worcester on kind of the development of their committee structure for oversight of their ARPA fund distribution. And so this is a way that we think that we can really push this process of more genuine engagement in the way that community members make those decisions. And then the third one is community vetted equity tools, and that is kind of a intentional decision-making process that asks, we call it a product and a process, that asks decision makers to look at kind of what the status quo of their process is and put it through a lens of equity through every step. It's not a checklist of if you do this and now you have equitable solutions, but it's really rethinking the way it's a guide to help to rethink how these processes are done in order to to reshape the way that we make decisions. The second section is community-wide policy change campaigns. Like I said, these are kind of external policies out in the community that we hope to support. So advocating to eliminate the cliff effect. So that's the effect where folks who may receive public benefits, they get a job or another source of income, and suddenly there's no more public benefits, and they have to make decisions of, is it worth it for me to get this employment in the first place? And so we're looking to help to support folks to navigate that and more effectively ease a transition and make it more accessible. Providing free, accessible public transportation. There's several initiatives for public transportation, free fare on the buses, and et cetera. Implementing complete streets policy. The Division of Public Health is really leading this work with, bike lanes and walking paths and different ways to flesh out our street infrastructure. Raising reimbursement rates for mental health human services contracts. As I'm sure you know, there's a crisis in human services mental health workforce field, and part of that we think is the low wage standards that are set by contracts by the state, and so there's advocacy groups looking to raise that. universalizing access to high quality, affordable education and care. The Common Start Coalition is our leader there, who is advocating for state legislation and funding in order to provide free, accessible child care to folks who would qualify. Offer free, high quality internet. As municipalities, we really look to leadership there. Implementing local police reform, including the establishment of crisis response teams through community collaboration. And there is current work there, also establishing like different pathways for alternatives when folks, are in crisis situations, call 911, that are not always have to be met with police response. Implementing comprehensive sexual education in public schools. As we know, many of the municipalities already have policy passed, but we want to support, this implementation stages. Universalizing access to home visits for services for families. Pernay Family Health Services is working on universal newborn visitation in the home, and we're looking to support them. Eliminating barriers to housing affordability and assistance. Many different examples of affordable housing coalitions and partnership work happening. And receiving Massachusetts age-friendly designation. And so Worcester is currently in the application process, and I am not sure where Shrewsbury falls, but I know there's a lot of important work on that. And then we kind of leave a placeholder of support policy campaigns being led by CHIP partners as a way to be responsive. And there's lots of examples of work we're working on now of policies that are brought to our policy and advocacy subcommittee. The committee reviews it and then brings to steering committee for approval for endorsement for the coalition.
Can I ask a question?
Sure.
Can you explain a little bit more? Maybe other folks know, but what is the Receive Massachusetts Age-Friendly designation?
So,
If you can.
I don't know if I feel like we should bring in an expert. I know I don't go to those meetings enough. But there's
High level.
Yeah. So there's a group that can be like that that there's a review of city policies and infrastructure that can show that the city is becoming accessible for like an aging community.
Okay.
And so it may be. And so I think that once a policy review and there can be certain recommendations, there has to be benchmarks. I can't remember. I think there was like 12 benchmarks or something they have to apply for and pass that to be able to be, show we have policies supporting, no discrimination and ageism for higher. I don't know. I'm making that up. I don't know if that's real. And I know they were looking at infrastructure for accessible physical activity infrastructure that's also accessible for seniors. We know we have a lot of playgrounds for children, but not always for adults and older adults. And so I think those are some of the things.
Aging community.
Yes.
Yeah. Okay.
Yeah, with the little added to it that becoming age friendly doesn't only means for seniors, but also means for children in general too. So if it's accessible for a senior, it'll be accessible for a toddler and then growing up. So it
Or
really
even somebody with a
encompasses
disability too.
Yeah,
right?
exactly.
Yeah.
So it really encompasses everyone and everyone to feel included no matter their age.
Got it. Great. Thank you.
Yes. Thanks, Karina. And the third and final section of the CHIP is this prioritized strategy and action agenda. And this is really, we hope, a way for folks. We don't want to lose anyone in the CHIP, although like the last CHIP, the 2016 CHIP had these sections like mental health and substance use and economic opportunity, access to healthy food. And, and in moving more upstream, folks asked us, how do I see myself in it anyway? Where's the substance use section? And so what this is hoping to guide people to see and to be reflective of is that, that although we are moving upstream, we are doing that in an attempt to be more impactful and actually to create opportunities for kind of cross-sector and cross-area collaboration. And so we hope that this guide can serve as a reflective tool for any program, and particularly calling out, though, kind of access to care, mental health, and access to healthy food as some of the and substance use as some of the priority areas, to take a look at these best practices and what the community said was needed in order to improve those programs to become more equitable and effective. And so these 6 principles are mobilizing community health services, and that means bringing them out of institutional spaces into community locations. So is there potential of having embedded therapeutic mentors and mental health providers, for example, in senior centers and youth centers or churches, instead of having folks having to come to make an appointment to be able to access those services. Providing delivery services for food pantries is another example we saw so valuable during the pandemic. Physicals and health screenings is another one. Are we able to embed those into, say, grocery stores or other spaces? Maybe not physicals, but health screenings, and then physical access, in schools and other places, school-based health centers. The second is organizing community-led information campaigns, outreach, and education. We know that there's significant limitations in the way information gets distributed. And so we're looking for kind of new best practices and tools to be able to deliver information about resources more effectively. Implementing trainings on principles of anti-racism, LGBTQIA acceptance, cultural humility, and empathic communication. This is like kind of a sister strategy to the municipal policy. So this is kind of create policies that trainings are required, and this is, implement the infrastructure for those trainings. And so with a broader range of kind of equity-based trainings, we especially heard the need in our community conversations for improved empathic communication skills, like with our customer service care, say at healthcare centers. Folks said, that was an obstacle for them accessing care, that when they called, you get the runaround, you're treated like, you don't know what you're talking about, you don't have your paperwork on deck, and so, why bother? Broadening and scaling resource navigation systems. This is a really attempt to improve what we're calling kind of human-centered referrals. We know that there's been lots of, we can Google anything. We can find like online platforms to find where resources can be found, but it can be overwhelming and confusing. And we want to look to how we can provide resources to expand the use of community health workers or centralized referral, like the family resource centers, where folks can call and you can say, okay, you're looking for a hot meal because you have COVID, but do you have SNAP benefits? Are you getting fuel assistance right now? Oh, you don't? Let me pull up that application and see if we can do it right here on the phone. Just has incredible value. Developing recruitment, retainment, and advancement strategies to diversify the workforce. This is, we know that it's impacting both quality of care as well as accessibility of care. Not having a diverse, accessible workforce, and we know that there's extreme workforce shortages and crises in a number of sectors. They're really important, critical to health. And so we are looking to best practices. There's currently a pipeline initiative. We're working closely with mental health and human service providers, which have a wide range of practices, from anything from introducing youth to the field to that raising reimbursement rates to human services mentorship, to work on advancement and gaining licensure. And so we're really looking to spread those best practices to some other industries and bring resources there. And then the last one is developing publicly accessible systems to track public health indicators and illustrate trends and increase data-driven decision-making. We know the value of data, and there's incredible limitations in what data is currently available. Oftentimes data, even in the CHA, even data that we look to, is old, it's not disaggregated. And we saw just recently through COVID the incredible value of having disaggregated neighborhood level data. You could say, hey, this population in this neighborhood had very low vaccination rates. Let's send vaccination services there. And we think this can be done across other health outcomes if we have the data available. And so we just are bragging that the city of Worcester, through the coalition, but really representing this larger regional work, received a Robert Wood Johnson Culture of Health Prize in, I think we're the 2020 cohort, but received it in 2021. And it's a national award recognizing communities across the country for innovative and upstream initiatives around public health. So sharing that, excited. And we hope this is a resource to be able to, or an award that we can use to leverage bringing resources in from the state and across the country. And so how do you get involved? So there's lots of ways. We have subcommittees and groups that we encourage community members to get involved in. Our racism discrimination subcommittee houses that top section of the CHIP. Policy and advocacy is the middle section. And then we hold quarterly action agenda meetings that kind of synthesize and bring folks together around the bottom section of the action agenda of the CHIP. We also have a research and evaluation team that looks at data. And so just getting involved is one way, but you don't have to be involved in a coalition group to be aligned with the CHIP. You can align work plans of organizations by supporting municipal racial equity policies or community policies, or using that reflective guide for your own organization or program. We can align funding and resources, and we're working with a lot of our local funders in order, a lot of them have questions on their applications. Is this a CHIP aligned strategy, and how we're looking to even strengthen that relationship. Using it to network and make introductions with other members. We have, a newsletter and, lots of ways we look to bring people together to help make connections, join one of the advocacy campaigns, use and contribute to the data, or supporting the coalition infrastructure are ways that can all contribute to this, and others, I'm sure. So we have a really cool website we work to develop, and it is embedded in the coalition website and might also be embedded. Is it embedded in the city website yet?
I think they're
It's in progress. And so the way it's built was that so that you can just, it's a general website that you can just build into another website, so folks can have kind of an aligned communication tool about what the CHIP is.
And of
If
course
you
it's not live.
if
I
you-
will.
If,
You
yeah.
keep talking.
Okay.
I'll get it
And
for you.
so this is a way we have more information about each strategy, as well as opportunities to get involved. And also we're going to be putting our evaluation data. So we have an evaluation team that monitors, what is the baseline and what is the annual outcomes of each of the strategies. And so
Why is it not doing it?
it's fine if you can't. It's really nice. But you can it has yeah. You can check it out sometime.
I'm gonna do it.
We'll try it once more.
We'll try one more time. I know it was working before when I tested it out. Is that it?
This is it.
Thank
Cool. Yeah, so if you scroll down here, and we have really nice photos because the Robert Owen Johnson Prize. That was one of the
Oh,
coolest things about the prize, is that they came and took lots of fancy photos. And this also has the link, I will say, to the full PDF. And so there's the poster, but there's also a full PDF document that also you can print out or have available that way to have all of the information. This describes, so that's where the links for the poster and that, it describes kind of the process and the development. These were our initial themes identified in that root cause analysis, what our structure and implementation for implementation is, and then it goes through every strategy and really describes what the rationale and evaluation process is for it.
It's a very great website. It explains everything.
We're really
as
excited
well,
about the website.
And it's interactive, which is great.
Also, just to jump in, as I mentioned, the web team for Worcester has it right now put on our website, and once that's completed, we'll be sharing all that text and information with all the alliance towns that we'd like to put on their own website as well.
Okay, great.
Nice. So this is just a summary of the subcommittees and the action agenda meetings that are available to join. So we have all these subcommittees. We use and this is a link. I'm like, what's on this page? This is a link that you can sign up for the email list, calendar invites for any of those meetings. And so
This link is working.
yes. It's fine. So yeah, if you click on that, it'll take you, or not. it should take you to a Google form where you can,
Bad technology.
yeah,
I can attest to that.
yeah, where you can sign up for any of those things. And then if you go to the next one, it's just a brief summary of when those meetings are. So like community engagement, we meet on the first Monday of the month from 10 to 11. We meet as the Racism and Discrimination Subcommittee first Wednesday, policy and advocacy second Wednesday, and then the quarterly action agenda is on a regular quarterly schedule, and research and evaluation is going to get on that quarterly schedule too. And so this is a resource that we wanted to share, and we as part of our work in kind of building training capacity is our Worcester Trauma Resiliency and Racial Equity Training Institute, and it's our foundational course. And this is really it's a 10-hour course spread over 4 days, 2.5 hours per day, and the dates for the next training here starts on April 28th from 9:30 to 12. And it really is looking to develop a trauma-informed lens to racial equity, understanding that racism is everyone experiences trauma, and racism is a primary form of trauma, both acute and chronic, for people of color. And so how do we build kind of understanding, shared language of what we're talking about when we say those things between providers and community members so that we can develop strategies to move forward. And so, so it's a free course, and I should have said more. And it is, we have open registration, and for this course, we are offering it in cohorts. And so there's going to be 3 cohorts: the Youth Violence Prevention Initiative, the Mental Health Task Force, and then we are offering the 3rd cohort, which has 15 available spots for Alliance Town members. So I know that Karen and Karina sent out information about it before, but we would really like help helping to promote that and recruiting folks to participate as this cohort that will have some breakout rooms and discussion space specifically about how do we apply this to our work across the Alliance.
I actually attended the last one. It was great.
Oh, awesome. Oh, cool. I recognize
right?
you. Yeah. Oh, that is so funny.
But I thought it was really great and provided an excellent framework that I've actually been able to take, and as I go through my day, be able to kind of call things out more specifically. So it's good.
Oh, that's awesome.
Yep.
Thank you.
And
Sorry.
No, that's okay. And I've shared it on the community Facebook pages and stuff like that. So.
Oh, cool. Yeah, such a different I knew I recognized your name. It's a different context. Yeah.
And I would just like to say something. I've taken a lot of training on racism and resiliency and equity, but what made this different, and I have to say, is the lens of trauma. I think this is the first time I've taken a course in this subject where they saw trauma and its importance and how it affects you, and how that all the inequalities and everything affect that trauma. So it was a great lens to have. So if you've taken something like this before, it still gives you a good refresher, and also it just gives you a new lens to look at the work.
And this is another tool that we want to offer, another resource is hot off the presses, led by Karina and Matt, is this CHIP reflective tool, which is really an attempt to guide people through that 3rd section of the CHIP and kind of reflective questions. What does it mean to mobilize? Is my program offering resources in folks in community settings, or in ways that the physical distance of where it's located are not significant barriers to accessing it? And so we are piloting this, and so are asking folks, we're going to collect information on a form here to kind of be reflective of their programs, and then we can then best direct people to access resources to be able to improve where they have identified the need.
Okay.
And I think this was really helpful when we were creating it. One, to really give organizations and municipalities to realize whether their programs were aligned and how they can align themselves more. I think a lot of people, when they were looking at the CHIP, they're like, well, I don't see myself, or that is my mission. How is this CHIP like? I'm like, well, it's about what the community needs. And if you're creating a service or you want to reach certain communities, you really need to understand them and what their needs are. So this really helps you align those programs, or if you have funding for something, to say, okay, so how do we create a food pantry that is mobile? What does that mean? Oh, we have this grant for food. Then how do we use that? How do we give it to someone already doing that work, but how do we make them align themselves with the chips? So it's just another way to really help you reflectively and kind of create a baseline on where you are and how you can get further into it. So, yeah.
And then, so this is in addition to our colleagues at the Regional Public Health Alliance. The coalition has a small but mighty staff. Myself and Chantel is our community engagement coordinator. Then Tempe is our evaluator and writer, and so are also available for support with the coalition and CHIP implementation. And that's it.
Great. Well, thank you very much for coming. Very, very interesting, informative, and I think it's very worthwhile.
Not disorganized.
Are there any further questions from the
No,
board?
it's great work. It's
Yeah,
awesome.
thank you so much. Yeah, really appreciate it. And like lots of ways, we know that the CHIP has been Worcester centric for a while too, and so we really want to make an intentional effort to be more thoughtful and work in partnership. We've worked in partner. We had cohort members from Shrewsbury. We work with Shrewsbury Youth and Family Services and a number of initiatives, but want to really increase the partnership here too. So always open to feedback and ways we can do that better too.
Great.
Great. Thank you very much.
Yeah, thank you.
Thank you for coming this
Yes,
morning.
thank you so much for having us. And I don't know why my phone is blowing up. Sorry.
Okay.
Thank you.
Thank you.
I don't want.
Casey, can you hang on a couple minutes after?
Sure.
Okay.
You're gonna wrap up this?
I think we're wrapping up, yeah.
Yes.
Okay.
we are. Okay, so the next item on the agenda is to review the meeting schedule. And Dr. Abram had to leave, but he indicated that May 20th would work for him. How does that sound for you, Jenny?
May 20th. I think that's probably fine. I can't believe we're April and, oh my goodness, it's just crazy.
Already talking May.
I'm gonna have a hard stop at 8:45 though, because I have
Okay.
a facilitator training at 9.
Okay. I think we could probably do that. Our meetings usually don't run beyond that. In fact, we're 45 minutes now with the CHIP presentation, so we could
Yeah.
probably, I'm sure we can do that.
Okay.
Thank you. Okay, so given that, the next item is a call for adjournment. Do I have a motion to adjourn the meeting?
I'll motion to adjourn.
I second the motion. All in favor signify by saying aye. Jenny Fishman?
Aye.
Myself, aye. This meeting is now adjourned. Thank you, everyone, for coming this morning.